Hello, and welcome to Arizona Desert Voices, the podcast from AARP Arizona, where we explore issues that matter to older Arizonans and their families. I'm Dana Kennedy, AARP State Director. Today, we're talking about a topic that many families don't think about until an emergency occurs: medical alert devices. According to the Center for Disease Control and Prevention, about 1 in 4 adults age 65 and older experiences a fall each year. While medical alert devices can't prevent a fall, it can help someone get assistance quickly if one happens. Joining me today is Dr. Darlene Moyer, a board certified physician in both family and geriatric medicine, and a recognized expert in caring for older adults. Dr. Moyer serves as Program Director for the Geriatric Medicine Fellowship and Associate Director of HonorHealth Family Medicine Residency Program in Scottsdale. Dr. Moyer, welcome to Arizona Desert Voices.
Thanks so much. I'm glad to be here, and thank you for having me.
Thank you. Well, let's start with a question that many families ask. When should someone begin thinking about a medical alert device?
This is a great question to start with because unfortunately, many times people wait until after something bad has happened to start thinking about this, when ideally we really want people to start thinking about a medical alert device before something happens. Because if you fall or you have some other medical emergency and you're not able to call for help, being alone and laying on the floor, for example, sometimes can lead to other complications and worse outcomes. So ideally, we want people to think about it before something happens. And there are some things that tip us off that it might be the right time.
Do you find that many people wait until after a fall or a healthcare scare before considering one?
Yes, unfortunately, in practice, that's pretty common. I feel that people are a more captive audience to talk about these things after something bad has happened because they have been scared or experienced something like this.
And, I read your article and I thought it was great. And one point from your article stood out to me. You say that the best medical alert device isn't necessarily the one with the most features, it's the one the person will actually wear. Tell me more about that.
Yeah, this is an important point because many times there becomes a power struggle at times between patients and caregivers, loved ones over this topic, and they feel like the medical alert device might be pushed on them or they don't really feel that they're ready for it. And so it's really important to consider the different features, which we'll talk about later, and whether the device matches what the patient has the ability to use and has the features that will benefit them the most. And is the more that they can be involved in that decision making, the more buy-in and the more likely they're going to be to actually use it.
Right, exactly. For listeners who may be exploring options for themselves or a loved one, what factors should they consider?
I think some of the biggest things to consider, I think there's basically three big categories of things to consider. One is, how fancy do you want the device to be? So do you want it to be a simple push button where all you have to do is push the button to call for help? Um, do you want it to be something fancier like a smartwatch, which some people can navigate and use the small controls and figure out the technology and some can't? The second category would be whether or not you want there to be automatic fall detection. And then the third category would be whether or not you want the device to have some GPS function. And so we can talk about who those things might be right for, but those are the big categories that people should consider in the beginning.
Great advice. And can we talk about some of those features? Like what situations might call for an automatic fall detection?
Yeah, automatic fall detection is beneficial when somebody might not have the physical ability to actually push the button, or you're concerned that they might have a bad fall and land in a position where they can't even move to get to the button. So some consideration for that might be somebody that has advanced arthritis or some type of physical disability that would prevent them from actually being able to reach and touch that button. And so in that case, the device would actually automatically detect a fall, automatically then call out and reach out to the patient asking if they needed help. And if it doesn't get a response, then automatically send help.
And what about GPS tracking?
Yeah, GPS tracking is really helpful for patients that spend a lot of time outside of their home doing things. So, for example, if they go for long walks or are out doing other social things or, whatever their hobby is, because without GPS tracking, the device really only works in the home setting close to the transmitter. And so this might be a good option for, like I said, those patients that are out and about. The other time to consider it is when you have somebody who might be at risk for wandering. So, for example, in cognitive deficits and dementia, if those patients, have a tendency to get out and start to wander, and you need to find out where they are if they're not responding, that would be an important time as well.
That's a great point. And this may be an important part of the discussion. Many adult children tell us their parents simply don't want to wear a medical alert device. How do you address those concerns?
This is important because one thing I've learned over the years in practice is there definitely is a perceived stigma among patients when it comes time to start using any type of device. And this isn't just isolated to medical alert devices, but it's the reason some patients don't want to use canes or walkers or things like that. There is this stigma, and they're concerned about being perceived as old or having a disability. So I think the biggest thing when it comes to medical alert devices is to really talk to the patient as much as possible and involve them. In geriatrics, we have something called the 4 M's, and one of those M's, this is like a pillar, a model for a practice. One of those 4 M's is focusing on what matters most to the patient. And so many times the patient will share that what matters most to them is maintaining independence and safety in their own home. And so then we can frame the conversation about how a device like this might actually help them support their own goals. And so trying to focus that conversation on what's important to the patient allows you to be more successful. The other thing is, just a little tip, is that some of these devices can actually be modified to look like jewelry and kind of hidden and disguised in a way. So if there is that concern about the stigma, that might be an idea to share with the patient as well.
That's a really good point. And, I just want to share, that, I've a person in my family who was recently, diagnosed with, mild cognitive impairment. And, she has a watch that she wears, and, we programmed it. So, if in the event that she were to fall, that it notifies. So she was actually in the backyard gardening, which she loves to do, and she fell. And, the watch asked if she wanted to call, 911. And because my stepdad was actually, monitoring a neighbor, he wasn't there. So it was able to, get my mom assistance when she needed it. And, it was able to notify all of us that, she had fallen, and then, transferred to the hospital, and, she got the care that she needed. But I've also found that, this watch helps her maintain her independence. And so, she can use it to be able to find her phone, which she uses all the time. And she, came to visit me, and she had lost her watch. So, and she was just wearing an old one. And I was like, Mom, we need to get you a new watch. Like, so we got her, a new watch. And, so it allows her to, to be able to navigate life. The problem is, she needs to be prompted to remind her to charge it. So got her a charging station so she can charge her watch and, and phone every night. So I think that, it is really important that, we do talk about, allowing people to maintain their independence, because it's so important. And I really like the approach that it's not taking away their independence, it's about protecting it. And, I think that that's really important.
Yeah,
And another important, oh, I'm sorry.
I was going to say that's a perfect example of how these can help support the patient. And, I have lots of stories very similar to that. For some reason, gardening seems to be seems to be the activity that gets people sometimes.
Yeah, I know. I've heard, so many examples just recently, of people who fall and, and suffer, a medical emergency. So it is a great way. The GPS tracking, is a great way to be able to help find somebody if, you don't know where they're at. Um, Another important consideration is cost. Many listeners may not realize that some Medicare Advantage plans may offer discounts or coverage for medical alert devices. Can you talk about that?
Yeah, this is really important because there is a cost associated with the subscription to these devices. Depending on the Medicare Advantage program, it's going to be different depending on which program you have, but many of them offer different perks that go along with the program when you sign up. And so this is one of the perks that either full coverage for a specific device or partial coverage, a discount, something like that, many times is included in the Medicare Advantage program. And so that's something I always tell people to start with, checking into their insurance to see what benefits they have there. And then the other thing that's important for people to realize is that different features. So, for example, the fall detection or the GPS, those have added fees depending on the company and the pricing structure as well.
That's a great tip and one that could save people money while helping them find the right solution. Um, I didn't realize that Medicare Advantage plans, some do cover medical advice, so that's really good to know to check their insurance coverage. Um, and you also note that choosing a medical alert device isn't a one-time decision. Why is it important to revisit that choice over time?
Definitely. Over time, as we age, our physical abilities, our cognitive abilities, our goals and what matters most in our health value system, those change as well. So, what you may decide in your early 70s may not be as applicable in your mid 80s or your early 90s as things change. So, I think it's important to not only be aware of what people have at home in my role, but then also to kind of reassess their changing function and whether or not that tool they already have fits their needs or whether we need to adjust a little bit as we go forward.
Great. And, I was wondering, is there other technology rather than medical devices that also helps people be able to age in place and keep their independence that you recommend to some of your patients?
Oh, this is an area that is developing so quickly. There actually is a lot of monitored video systems out there that also can detect falls and that family members, loved ones can tap into and see, hey, I haven't seen them walk through the living room for a while. I probably need to check in. Those definitely need to be discussed with the patients because there's obviously some privacy concerns and some patients get really leery about having cameras in their home and feel like that's taking away um, from their privacy, like I mentioned. The other thing is there's things like automatic medication dispensers that are out on the market. So if somebody's having trouble remembering their medication, there's those kind of devices. There's all kinds of modifications that can be done to appliances and things like that to help maintain safety and independence. So this is just a huge area of growing technology. Robots, believe it or not, AI tools, things like that. This is just exploding right now. So huge topic of things that are coming on the market for supporting independence and aging in place.
Yeah, I have been, researching some of those technologies myself, and it is amazing some of the technology that's available. And one that I'm really interested in is, I know this isn't medical devices per se, but it's called LEQ. Are you familiar with LEQ at all?
I'm not, no.
Yeah, LEQ. It's a little, I don't want to call it a robot, but it is kind of a robot, and it's a small device about this big, and you can put it in their house and they talk to it, and LEQ uses AI to kind of get to know the person, and then they start, it uses the AI for prompting as well, but it starts out just as a small conversation, and then it will start to remind you to take your medication. And um, one area agency on aging in New York, they did a study on it, and it actually reduced social isolation and feeling loneliness. So I thought that that was a great benefit as well. Not so much a medical device per se, but emerging technology, I think, is where we are in society. So before we close, Let's leave our listeners with a few simple questions they can ask themselves or loved one. Will I wear it every day? Can I use it comfortably and confidently? And am I at a greater risk for falls? Any thoughts on any of that?
I think those are all really core questions to be asking. Obviously, cost is another one to bring up because some patients may not be able to afford these. There are some community resources, by the way, that could help if cost is an issue for patients. But I think starting with those core questions and checking in with their insurance program, that's a great place to start. And then, like we said in the beginning, really trying to involve the patient, if at all possible, in this decision. So there's buy in and more likelihood to actually use the device.
And how would you start that conversation?
Well, I think part of what I love about geriatric medicine is that it's so individualized to each person.
Mhm.
So I think it just depends on what issue they're struggling with, what changes we're seeing, whether there's already been falls or medical emergencies that have happened, or if it's family starting to see something and sharing those concerns with me. Um, I really think it just has to be in the context of who the person is and what's happening in their life in that moment. And
Mhm.
also, in alignment with what they've shared with me of what's important to them and what they see their goals for themselves as they go forward.
Right. And I guess other questions that people might want to ask is, would an automatic fall detection provide extra peace of mind? Would GPS tracking be helpful? And have I checked to see whether my insurance offers coverage, which you've mentioned that a couple times. And if you're considering a medical alert device, those are definitely great places to start.
Yes,
Um,
absolutely.
yeah. Anything else you would like to add before we close?
No, I think we touched on the highlights. I think understanding the different features that these devices have to offer is really important. One thing I also would say is that fancier technology is not always better, because if somebody gets frustrated with not being able to figure out the technology, they will not use it. So
Right.
sometimes simple is better. Um, but I think we touched on most of the important things.
Well, great. Dr. Moyer, thank you for joining us and sharing your expertise.
Great. Well, thank you so much for having me. I appreciate it.
Great. And one of the key messages from today's conversation is that medical alert devices aren't about limiting independence. They're about supporting it. And the best device is the one that fits your life, your needs, and most importantly, the one you'll actually wear. For additional resources on healthy aging, caregiving, and living independently, visit aarp.org/Arizona. I'm Dana Kennedy, and this has been Arizona Desert Voices. Thank you for listening.